Yeah, and the thing about autism is it looks like a specific interaction with a specific something, right? Because it has these hallmark features that are affecting social awareness. As I said, acetaminophen affects social awareness in adults too. And it went from essentially zero, looking at countries without modern medicine, using Down syndrome as a baseline, to 3% of the whole population right now. And these hallmarks, right? This is the key. It doesn't look like 50 different things. If you look at mercury poisoning versus lead poisoning,
Right.
they look different,
Right. Right.
right?
Right.
Right. So it looks like it's specific based on the diagnostic criteria. So it doesn't make sense that 50 different things can cause it.
It's a specific thing, but it's a specific thing interacting with a pre-existing susceptibility within the right developmental time window.
Right. And you get the spectrum based on when you get exposed and how much other susceptibility factors you
Right,
have.
right,
And
right. Interesting. So, well, yeah, I mean, this is very interesting because again, if what you're saying is true and all of these things make sense and fit together, and people start behaving differently with respect to early life exposure to acetaminophen, we will see a clear change in the trajectory of autism and other things apparently within the next couple of years.
yeah, my guess would be ADHD. So
Yeah.
what I'm told by clinicians is half of ADHD is probably, just children that don't want to behave, and half of it is really a kind of disorder. But that's, who really knows, right? But the bottom line is, I think you'll see a big drop off in that as well. But that's just a guess. I mean, what I'm saying about autism, we have this quote unquote certainty without reasonable doubt. Whereas ADHD, it's like, well, it makes sense. There's a lot of indications that Asperger's and ADHD are sort of part of that injury spectrum.
Mhm.
So you should see, the guess would be that those will all drop off, but we're super confident about the autism spectrum disorder.
Yeah, yeah. Are there any final thoughts you want to leave people with, or anything you want to reiterate on this subject for people?
Yeah, absolutely. So back in the day, we discovered the function of the human appendix, right? So the main thing we had to tell people was, look, just because we know it has a function, if you get your appendix is hurting, you need to go to the doctor, get it taken out so you don't die. So by the same token, if your child has a headache and it's not just, from bumping their head, or even especially maybe if it is from bumping their head, whatever, you need to go see the doctor, because especially if they have some conditions, it's not just normal teething, it's just not a normal fever from something they caught at daycare, right? It could be something really dangerous. So we're not saying stay away from the doctor, don't go see your doctor, because that could be very, very dangerous. Most fevers are just, it's natural part of your immune response. You probably shouldn't suppress it, because it's, you're basically immunosuppressing your child. But it could be a sign, especially if it's a fever above normal in duration or in temperature, that something else is wrong. It could be an underlying problem, and you got to go see the doctor.